We've all been there. You feel a weird ache in your side, and suddenly it's a late-night internet search. You're hunched over your phone, scrolling through medical forums, convinced that a minor muscle cramp is actually a rare disease. For most people, that spike of midnight panic vanishes the second the browser window closes. We wake up, the ache is gone, and the worry disappears. But for others, that internal alarm never shuts off. This is illness anxiety disorder, a condition formerly known as hypochondriasis. It occurs when the brain's threat detection system locks into a permanent daily baseline of health-related dread. In this state, the internet functions as a psychological trap. The desperate search for information and answers effectively becomes the disease itself. People living with illness anxiety disorder typically follow one of two paths. Many schedule endless, just-in-case doctor appointments to seek reassurance, while others avoid medical care entirely, paralyzed by the fear of receiving bad news. Those who constantly seek reassurance drive a massive amount of avoidable healthcare utilization. They cycle through repeat clinic visits, expensive specialist referrals, and unnecessary diagnostic workups. This graph shows the central tragedy. A clean bill of health drops a standard patient's anxiety to zero, but for someone with illness anxiety disorder, relief is brief. Their anxiety sharply drops, only to rebound to peak panic within hours. The modern medical system often attempts to treat a cognitive software glitch by running physical hardware tests on the body. Clinicians diagnose illness anxiety disorder based on a specific, sustained pattern, a severe preoccupation with having or acquiring a serious illness that lasts for at least 6 months. It is distinct from somatic symptom disorder. While somatic symptom disorder involves distress over real physical pain, illness anxiety disorder occurs even when significant physical symptoms are entirely absent. This explains why a well-meaning doctor's reassurance that nothing is wrong often backfires. To the patient, the agonizing dread is very real, and dismissing it only creates feelings of invalidation and distrust. Effective treatment begins when a physician validates the patient's psychological distress, even while setting aside their specific physical fears. This circular flowchart models the cognitive mechanics of the condition. A minor bodily sensation triggers a massive anxiety spike, which forces the person to engage in a safety-seeking behavior. Whether it's meticulously checking a pulse or asking a doctor for tests, this behavior creates a brief illusion of safety. The anxiety cycle momentarily pauses. This relief eventually collapses. By performing the check, the brain confirms the irrational fear was worth investigating. This reinforces the obsessive cycle and ensures the next panic spike is even more intense. Medical reassurance effectively fuels the disorder it is meant to solve, sustaining the very anxiety the patient is trying to escape. True healing requires a fundamental shift in perspective. The patient must address the anxiety itself as the primary condition requiring treatment, rather than the specific illnesses they fear. This animation illustrates how cognitive behavioral therapy targets and dismantles safety-seeking behaviors. By removing these actions, CBT starves the loop of the reinforcement it needs to survive. Mindfulness practices further help patients change their relationship to bodily sensations. They learn to observe a random ache or twitch objectively, without interpreting it as a catastrophic event. When appropriate, physicians may also prescribe selective serotonin reuptake inhibitors to help lower the physical intensity of the health-related panic. Rewiring a brain stuck in survival mode involves moving from instinctively reacting to bodily sensations to calmly observing them. If this cycle sounds familiar, remember that attempting to self-diagnose through more internet searches is part of the disease pattern itself. Official diagnosis and treatment plans must come exclusively from a licensed clinician through a structured clinical interview and medical history. Coping and healing counseling provides specialized health anxiety-informed care. Their team includes over 15 licensed therapists, providing a diverse and culturally competent approach to mental health. They offer fully HIPAA-compliant telehealth services for individuals, couples, and teens age 13 and up, serving all 159 counties in Georgia. Specialized care is highly accessible. Coping and healing counseling offers $0 copays for Medicaid and rates between $10 and $40 per session for major carriers like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana. It is entirely possible to break the exhausting cycle of illness anxiety disorder and reclaim your life with the right therapeutic support.